Hi everyone, Dr. Jenny Brown at Northeastern Reproductive Medicine in Vermont. Today we're talking about part 2 of the IVF process, the egg retrieval and what happens in the lab. Last week we talked about part 1, the ovarian stimulation to grow a group of egg follicles. So go back to that video if you missed it. But the goal here is to demystify this process and really empower you with knowledge so that you can take advantage of this successful treatment. So the way I've decided to do these videos moving forward is give you the goal of the topic, what you need to know, and then the risks and benefits, and the kind of pros and cons. So starting today, what is the goal of the egg retrieval and what we do in the lab? The goal is to optimize your potential. So if you've been developing a group of 10 follicles, the retrieval, the goal is to drain all those follicles and get out as many eggs as your ovaries will give us. So IVF is a funnel. It starts with a number of eggs that we retrieve, and then there's going to be a number of eggs that are mature, that fertilize, and then that grow as embryos. And it's really normal to start with 10 eggs and end up with 2 embryos. So we want to maximize that starting number to give you the best chances of success. Next is what you need to know. So for the IVF retrieval, you'll be here at NRM for about 2 hours. The procedure itself takes about 20 to 30 minutes, during which time you'll be asleep under anesthesia. You'll have an anesthesiologist with you the whole time, and you'll be given IV medications, propofol and fentanyl, to help you sleep and be pain-free throughout the procedure. The procedure is ultrasound guided. And so what that means is we're watching the whole time on ultrasound, just like your ultrasounds leading up to the retrieval. This time, the only difference is we have a small needle guided along that ultrasound so that we can drain each of the follicles from the right ovary and then drain the follicles from the left ovary. And that little puncture wound, you will not notice. It's in the top of the vagina. It'll close up on its own, usually does not require a stitch. It's kind of like where you get your blood drawn, but just once in the right side of the vagina and once in the left side of the vagina. So at the end of the retrieval, when you wake up, you'll know how many eggs we retrieved, and then those eggs will be sent to the lab for the next steps in your IVF embryology plan. And the next question we wanted to answer is, what are the risks? So the risks of the retrieval, just because it is a surgery, are about a 1% risk of injury to something else in the abdominal cavity. But again, we're watching the whole time on ultrasound, and those follicles are big, obvious targets. Also, we're not going to try to be a hero and get an egg that is really far away, especially if it's small and doesn't have a high likelihood of yielding a mature egg, if it risks injuring something else in your abdomen. So that's the egg retrieval. Then the eggs are going to go to the lab, be fertilized with sperm, either through ICSI, which stands for intracytoplasmic sperm injection, or through conventional fertilization, where we surround the egg with, say, 50,000 sperm and let them fertilize overnight. Whichever way is right for you, the next day you will know the results of the fertilization, and you'll get contacted by your care team to let you know how many eggs fertilized and are now embryos. Those embryos then grow in the lab until the blastocyst stage, which can take 5 to 7 days. And the blastocyst stage is a beautiful stage where the embryos show us 2 different cell types, one called the inner cell mass, and that's what becomes the baby, and the other called the trophectoderm, and those are the cells that become the placenta. So that is the goal of what happens in the lab, is to make beautiful blastocysts and freeze them or transfer them, depending on whether you're having a fresh or frozen transfer. More on that later. That will be the subject of next week's discussion. For today, we have covered the egg retrieval and embryology portion of your IVF potential future journey. So if you have any questions, please email me at drjennybrown@nrmvt.com. Thanks. Have a great day.